DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Triangle Vaccines. Triangle, protection you can trust.
Hey there folks, welcome to Doc Talk. I'm Dr. Dan Thompson. I'm really glad that you joined us today. Dr. Brian Lubers from the Kansas State Diagnostic Laboratories here. We're going to talk about mastitis in dairy cows. Stay tuned and I hope you enjoy today's show.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
Hey there folks, welcome to Doc Talk. Brian, thanks for being here.
Thank you, Dan.
Folks, this is Dr. Brian Lubers, and he is a veterinarian, and he is the Director of Microbiology for Kansas State's College of Veterinary Medicine's Diagnostic Laboratory. And Brian, you know, we're going to talk about mastitis, and you've had some experience with mastitis in your, as a practitioner and as a microbiologist / diagnostician.
Yep.
Big problem.
Yeah. So when we talk about mastitis, it's really the #1 problem we see in dairy cows. By far the most economically important disease in the dairy industry. And when we talk about mastitis, one of the big things is always finding it. And so how do we do that? And I think it's really important. Dairymen that have been in this for a long time, they kind of understand this, but really what we're talking about is infection of that udder. And so they're looking for changes in the milk. There's some cow side tests that people use. The California mastitis test is really common. Changes in the somatic cell counts within their herd. They look for all those things. And on our end, at the diagnostic lab, one of the big things we do is we do milk culture work. And so we're taking milk samples from producers and we're looking for the bacteria that we know that cause mastitis in these herds.
So when you have mastitis, I mean, I'm going to make the assumption that #1, you wind up with sick and possibly dead cows from this if it gets systemic, decreased performance. What are some of the things that it costs us?
Sure. The big costs is actually lost milk production.
Okay.
There's been quite a few studies that have shown that as cows get more of an infection, they lose more milk. There's also veterinary costs, there are drug costs, there are laboratory costs, all of that play into it, but by far and large the biggest cost is the lost production that we see.
And today, milk prices are extremely high.
Sure.
And and that's because we have such a demand and short on cow numbers, but as we're building this up, keeping those cows healthy. It's also an animal welfare concern.
Absolutely. Yeah. And I think, the biggest thing is the clinical mastitis. So that's the mastitis that we see from changes in milk, fever, swollen udders, those things. But the bigger losses are actually from the mastitis that isn't detected. So the early stage disease where we just don't see those changes.
Okay. When we start to, look at the changes, what takes it from a subclinical to more of a clinical? Is that more cow dependent or dairyman dependent?
It's really just the progression of the disease. So cows that are just getting an infection in the early stage of the disease, maybe we don't have that change in the milk yet, so we don't have that clotted milk that the dairyman would actually find during milking and diagnose that cow as having mastitis, and then treat that animal. So that early stage infection, and yeah, you're right, there's some cow dependent factors. Some cows are able to resist that infection for a longer period of time, and so that subclinical phase may last a little bit longer. Obviously, the dairyman has some influence on that. How aggressively are they looking for mastitis? Because the earlier they detect it, then we move into that clinical stage.
Great. Well, we're going to have to take a break.
Okay.
When we come back, folks, we're going to talk more with Dr. Brian Lubers on mastitis, and we'll talk about some of the control strategies that you can use with diagnostics. You're watching Doc Talk, and we're sure glad that you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Meet the Veterinarian, brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Dr. Doug Ford is the owner of Beaver Creek Veterinary Clinic, located in Brush, Colorado. He is also a partner in Production Animal Consultation, a science-driven, people-focused group of advisors serving animal protein producers worldwide. Doug and his wife Jan are the proud parents of 5 adult children, and as a family, they are passionate stewards of their ranches and livestock.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice.
Join the team, the Beef Quality Assurance Team. Getting BQA certified shows you're committed to practices that produce the highest quality beef in the world. And by visiting BQA.org, you can take the online certification course at a time that fits your schedule and from the comfort of your home or office. You'll also find lots of helpful tips on improving animal health and animal handling practices. Get certified, BQA certified, because it's about doing the right thing. Visit BQA.org today and become a member of the BQA team.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here at the College of Veterinary Medicine with my friend and colleague, Dr. Brian Lubers, who's over at the Kansas State Diagnostic Laboratory, where he serves as the Director of Microbiology. And we're talking about mastitis, and when we left, we were kind of talking about how it can be, clinical, subclinical, but at the end of the day, when we're talking about whether it's mastitis, calf scours, bovine respiratory disease, it's control and prevention.
Sure, absolutely. And I think with mastitis, the big thing, we know it's control and prevention. It's about managing the animals both in their environment and in the parlor. Those are the big things, but really a lot of it's about diagnosing it and just finding it. And so, we kind of mentioned the farmer level, how he diagnoses mastitis and looking for changes in milk. I think part of a big thing that we really emphasize is having that laboratory diagnosis. Really helps, because mastitis looks the same, whether it's caused by an E. coli or it's caused by a Staph aureus, which are our two biggest pathogens. The farmer really has no way to tell just by looking at the milk which of those he has. And the the treatment and the management for those two pathogens is really quite different. So at the end of the day, we have to know what bacteria we have in that herd to really tailor our strategies for that herd.
So kind of walk me through what you're talking about as far as how we take the samples and how we, you know, kind of keep up with it. What are some of the management plans or diagnostic programs that you recommend?
Sure, and there are two types of samples when we talk about managing mastitis in a dairy herd. There's the individual cow sample, and really what we're looking for with that piece of information is what bacteria does that individual animal have.
Yep.
And we can do things in our lab to test different antibiotics to see which ones would be the most effective for that infection. So that really gives us information about that animal. And then the other sample that we commonly get are bulk tank milk samples. And really what we're looking for there, we're trying to get a profile of what bacteria are predominantly in the herd. And you know, again, we decide, do we have mostly environmental pathogens, mostly contagious pathogens, those kinds of pieces of information to really help us tailor our management strategies.
Yeah, because if you have something that's in the environment, you know, it's going to be really, well, they're both management heavy in preventing, but how you're going to go about, whether it's bedding and different things.
Sure. Yeah, an environmental pathogen, we'd look at managing the bedding, maybe decreasing cow density if we're overstocked in our pens. With a contagious pathogen, it becomes a lot more about isolating animals or identifying animals and then milking them separately just to keep them away from the non-infected animals.
Right. So we're talking about either animal to animal directly or animal to animal through the environment.
Yep, absolutely.
And then you know, the other thing I think that just kind of, you know, when we say, okay, we're going to do a test on the bulk tank, that's before we go through pasteurization and.
Absolutely. Yeah, absolutely. There are multiple public health steps in between the farm and when it gets to the grocery store that help that. But yeah, absolutely.
Yeah. Well, we're going to take a break. When we come back, we'll discuss some of these things that we've decided we're going to talk about as far as dry off and when they calve and different management techniques to prevent it.
Okay.
Thanks for being here. And thank you for watching Doc Talk. We'll be back in a minute.
The BQA tip of the day, sponsored by Beringer Engelheim Vetmedica Inc.
Today we're going to talk about taking care of your syringe and cleaning it after you get done. First thing you want to do is take the syringe and clean the outside with warm soapy water, get all the manure and different things off of the syringe. Then you're going to take the syringe apart to clean the inside. On the inside of the syringe, never use soap. Only use warm water to rinse that inside of the syringe out. We're going to let the syringe dry, and after it dries, we want to put it in a dust-free environment. One of the best places, put it in a Ziploc bag and then put it in your freezer. But before you use the syringe for the next time, make sure that you allow that syringe to warm up to room temperature. That's today's BQA tip of the day. The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
In the springtime, cattlemen need to be thinking of preventing important diseases like pink eye. Pink eye prevention includes management factors like good fly control, pasture management, along with a good vaccination program. Eyesight from AgriLabs has broad efficacy coverage as its origin from 8 different field isolates of Moraxella bovis. It is safe, smooth, highly syringeable, safe with young calves and pregnant cows, and provides superior protection against pink eye.
True Test Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Brian Lubers, and Brian is the Director of Microbiology at Kansas State University's Diagnostic Laboratory, and we're talking about mastitis. We've talked about some of the pathogens, environmental versus animal to animal, but let's go back and talk about the individual cow sample.
Absolutely. So when we talk about an individual cow sample, obviously we want just milk from that one cow. And so the things that we emphasize, and I think all diagnostic laboratories kind of have the same set of standards, but the ones that we really focus on with producers are, it's about making sure that that sample comes in as clean as possible, because a lot of the bacteria that we see from the environment also cause mastitis. And we want to make sure that what we're growing is actually coming from the cow. So it's all about collecting a really, we use the word sterile, but it's very, very clean sample when it gets to the lab, so that when we grow bacteria, there's no doubt that that's what's causing the infection in that animal.
Work with your veterinarian.
Absolutely.
And have them help you with the technique of getting the proper sample.
Absolutely. Yeah, and you know, they have all of the equipment to take the samples. They should have the training to be able to help you put protocols in place to collect samples. We actually have kits available if people are interested. We can ship out that have instructions, sterile containers, all of those good things, but really it's all about clean samples.
So they can get the sample containers by calling the diagnostic lab or emailing the diagnostic lab and get those. But you know, a lot of times most of these dairies are going to have a veterinarian that somebody that could also call and get those sampling kits from us.
And we always encourage they work with their veterinarian. There are some things about interpreting those results and how to design the next step in management and treatment that really it's best to have a veterinarian on the field to help you with it.
Absolutely. Well, when do you want to take samples from cows? If let's say we're going to do you know, individual cow sampling across our dairy, when are some of the times that we want to be taking samples, or that you guys recommend?
Sure. A lot of it depends on what risk the owner is willing to accept as far as how much subclinical mastitis they have in their herd. But kind of the baseline that almost all herds will do is clinically affected animals. So if they get an animal and you're concerned about mastitis, maybe you haven't done a lot with mastitis in your herd and you don't know what bacteria you have, it starts with the clinical animal. So this is an animal we know has mastitis. We're going to collect her, see what's there, and we can do that. The bulk tank samples that we talked about are always kind of a good starting point, because that gives you a profile, and that's something, it's probably the easiest one to collect, because you collect a few bulk tank samples over a period of days and we get a nice picture overall what's going on. Other than those two, then it really gets into, like I said, it gets into the risk the owner is willing to accept. We can certainly look at samples at freshening is probably the next most common. So right after an animal starts lactating, we like to get that colostrum out, so give it 2 to 3 days, and then that first milking that we start to collect is a good one.
Cool. Well, let's take a break. When we come back from the break, folks, we're going to discuss more with Dr. Lubers about some of the management techniques and some of the things in managing mastitis.
Sounds good.
Thanks for being here. Thanks for watching Doc Talk. We'll be back right after our break.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook. Specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle, Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
American innovation is being driven in places you might not expect by people like Brent Hayek, an Oklahoma family farmer, who recently set a world land speed record in a Ford Super Duty pickup truck powered by renewable B20 biodiesel. Advanced performance is here, now, putting America on the fast track to more jobs and energy independence. Biodiesel, America's advanced biofuel.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Brian Lubers, and we work at Kansas State University. Dr. Lubers is the Director of Microbiology over at the Kansas State Diagnostic Laboratory, and we're talking about mastitis. And so, you know, it's a bacterial infection, so antibiotics obviously play a role in the treatment.
Sure.
And you also are a pharmacologist, not just a a diagnostician and a veterinarian, but a clinical pharmacologist. So what are some of the things when you're talking about antibiotics and the roles and things that are changing in our industries?
Sure. We're starting to see a lot of regulations about not using antibiotics or decreasing the use of antibiotics in animal agriculture. And I think this is probably as good of a disease to illustrate that as any. When we talk about mastitis, it really is about prevention and management and control, and we really are using antibiotics when those systems break down for some reason. And it's not a total breakdown, but obviously we can't control the weather. We can't control a lot of things, and so we'll have mastitis. There's no doubt. Every cow that lives long enough will have an episode of mastitis. And so when we're using antibiotics, we want to make sure we're using them appropriately and effectively. In the dairy industry, we're pretty limited as far as the types of antibiotics we can use. Obviously, we're making a food product, and we want to make sure that that's safe as well. So, but where our lab kind of fits into that is going back to that testing. We can take those specific bacteria from your herd or even from the individual animal on your herd, test it to a panel of antibiotics, and tell you what should be the most appropriate antibiotic to use. And I think that's a good, what we're seeing is if we're going to use antibiotics in agriculture, we want to make sure we're using them appropriately. And I think that really helps give the farmer and the veterinarian some evidence to say, yeah, this is the best antibiotic for my herd. Yeah,
and I agree. That when you have, it's a little bit different in the dairy industry when you have continuous milking, an opportunity to sample that animal daily or multiple times in the same day. In the beef industry, we don't have that luxury. I look at mastitis and bovine respiratory disease kind of as parallels, and we don't have that opportunity to take a lung sample, every day. I mean, what a distinct advantage and something the dairy industry really ought to take advantage of. The Kansas State Diagnostic Laboratory has been a leader in this, and specifically underneath your tutelage. Are there things that you would want people to know, or dairies or people out there to know about some of the things that you're offering?
I think just, we're here to help with the diagnosis. We're here to help with the treatment. We'd love to help veterinarians work to help. There are two of us that really work in this area at the diagnostic lab. We've got experience in the field with dairies and mastitis. We're always willing to come in and help people with that too. And like I said, I think on the antibiotic side, we really want people to know that when we use them in dairy, we're using them the right way.
Absolutely. Well, thanks for joining us today, and thanks for the service that you're providing.
Thanks for having me.
Folks, thanks for being with us today on Doc Talk. Remember, always work with your local veterinarian, and if you want to know what Dr. Lubers and I do here at K-State, you can find us on the web at www.vet.ksu.edu. Thanks for watching Doc Talk. I'm Dr. Dan Thompson from Kansas State University, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Triangle vaccines. Triangle, protection you can trust.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it has been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.